It turns out winter weather does a lot more than just cause problems on the roads. It can also cause serious health problems. Dr. Kevin Campbell here this morning with more on that. Doc, good to see you.
Good to see you, Phil.
What can happen outside when you're working outside in this type of weather, Doc?
So when we're outside, our heart and cardiovascular system has to work harder to maintain our core body temperature to avoid hypothermia. So if you have some type of underlying heart disease or condition where you may have heart disease and don't know it, you could have a heart attack in this situation.
Now we're talking about shoveling, anything, any type of work that you're doing outside.
Exactly, and one of the key things we need to remember is if you have to work outside in this terribly cold weather, you need to take frequent breaks. You need to make sure that you dress in several layers so that you can stay warm, and particularly important to cover your head because we lose a lot of heat out of the top of our head.
Doc, we're having some issues with your microphone, so what I'm going to do is I'm going to put my microphone on you.
Okay.
TV magic here.
Wow.
And why don't you go in and tell us a little bit more about, you experienced this, right? Your heart rate went up, you were outside shoveling?
Absolutely. I shoveled my driveway and my neighbor's driveway the other day, and we actually dressed in layers, my wife and I, and we took frequent breaks, and we noticed that, you know, when we finished, we were soaking wet on the bottom layer, so you really can get your heart rate up to a pretty high level. So.
You know, I told you, my last station I worked at, we actually did a story where at the beginning of the story, we had our anchor basically check his heart rate. He started shoveling. We went into a minute-and-a-half story, came back out on camera, checked his heart rate again. I think it went up to about 190, a 190, which is pretty typical, I would imagine, right?
It is, and I think we have to be very careful for people who do have heart disease that you have someone else do this type of work for you. Another important point is that we want to make sure that you avoid alcohol and caffeine during these times, because if you don't, it can mask the signs and symptoms of a heart attack.
Other safety tips, what should folks know? What's the bottom line?
Make sure that if you go outside, you dress in layers, you spend limited amounts of time outside. If you have any type of confusion, dizziness, lethargy, anything of that sort, you may be experiencing hypothermia, and that is time to get out of the cold.
There you are, right there, a little picture of you outside. Goodness. Good job, good job. Thank you very much, Doc. Always good to see you. And of course, put my microphone back on. If you have a question for Dr. Kevin Campbell, really easy. Log on to our website, WNCN.com. Search links we mentioned. From there, you can find Dr. Campbell's website, or you can like his Facebook page, or you can even ask him a question on Twitter. He does respond, Bill Ray.
Yes, I know.